چې دی اوس دا آینه ده ما ته ګورئ بیا د دې آینې نه چې کومه آینه راځي زړه ته دلته هارټ اپ ساید ډاون شي دا سمه به باډي راشي نو دا غټ شي هغه هم نه ده غټه لکه دا ښې نشانې دا ښې نشانې. This is a 18-year-old male presenting at my clinic. First time. My name is Dr.ghulam farooq. We are here. Patient has no cyanosis, no clubbing, and there's trisomy 21. These are the bones. The patient is labeled that this is disabled child with cardiac disease which is unoperable. He was seen by all KPK including Raul Findi. Someone did genetic test. If someone have this defect at the heart level and all the clinical features of chromosomal disorder, I think no need for the chromosomal study. The patient is unable to speak and the level of D is just undecodable. This should not be less than 75. Why the muscular VSD not close so far? There is no cyanosis, no clubbing. Any comments? Why the patient aggressive mood, headache, sweating? And why is the label is disabled baby? Anyhow, he telling the father, I have a headache. The hemoglobin level is this. Actually, he was missed from the very beginning because actually that is a rickety osteomalacia, osteopenic bones, reasons, age, and critical hormone D deficiency. The causes for hormone D deficiency is not using 20 to 30 minutes direct sunlight in the summer on the skin, or second, not using 1000 to 7000 unit of hormone D in the winter, or not use 1000 to 7000 units of hormone D from birth so far. Today is 12/10/2021. So when the hormone D source in the world is a the source of the hormone D, that is 7-dihydrocholesterol. When the sunlight, thanks my country is Pakistan, is a sunny country, there is ultraviolet rays A, B, C. In the air is, these are called ultraviolet rays, and these rays are only seen by the dogs. When the air is frequency is more than 400, should be avoided, and the B rays are the best, and the C is controversial. Some people say this absorbed by the ozone layer or cornea. When the sunlight direct hit the basal skin and spongiosum in the skin, there is 7-dihydrocholesterol. So they change to that pre-vitamin D3, and the level D2 in the kidney they change to corticosteroid hormone D3. They should not be less than 55 to 75. Now they come to the small intestine, to the ileum. If the ileum is normal and there is no malabsorption syndrome, now they do two important functions: absorb the calcium for the bones and teeth in every cell of the body. The second, absorb the magnesium. So when the magnesium not used in the children group, the muscles and nerves underdeveloped, so the VSD unable to close in the dilated heart even, and the nerves is underdeveloped, so my patient is unable to speak. There is headache and sweating, and vestibular nerve become weak, so there is vertigo fall, and the cochlear nerve become weak. There is early deafness in Pakistani people, and especially myopia and squint also, because the hormone D absorb the calcium for the bone and teeth and every cell of the body. The second they absorb the magnesium, so not using magnesium in the children group due to phobia, autism, and the adult group there is depression, anxiety, and headache, and hair loss and fall, just like me, because I have not exposed my skin for more than 30 years. At that time I was unaware of the benefits of sunlight, and that is the whitening and hair fall, and sleep problems and headaches, and bad taste in the mouth, and sweating, and loss of self-confidence, in unable to cope stressful condition, aggressive mood, and memory is decreased, libido is decreased, and there is sweating and headache and sleep problems. Especially the Muslim people abusing, not accepting the reality of other people. That is the reason we are suffering of magnesium deficiency. And so the most important function of the sunlight when they hit the skin, there is a lithocidine formation, which is a chemical also stimulation of lymphocytes, and there is no proper use of zinc and hormone D deficiency, so the immune system become depressed. So the worst suffering of corona and different infections in tuberculosis, and there is throat infection which lead to rheumatic heart disease, and otitis media, acute IgA asthma, and infections, viral, bacterial, fungal, and allergies. Now, when the hormone D become depressed, the autoimmune system is uncontrolled. So the autoimmune system stimulation occurring, which lead to diabetes mellitus, psoriasis, colon, different carcinomas, and there is psoriasis and vitiligo. When the sunlight is not hit the skin, the 7-dihydrocholesterol is not changed to this. When the sunlight hit the skin, this 7-dihydrocholesterol should be used. Now there will be more 7-dihydrocholesterol for the sunlight. So where will be the source? That will be the blood, and that blood will be sent more this substrate. When this is not used by the sunlight, the body will be not send more cholesterol, so the cholesterol will remain high in the body. So when the cholesterol is increased, the body weight is increased, and there is slowly narrowing of the arterial system, which leads to coronary artery disease, and CVA, and PVD, and carotid artery disease. This disease should not be present in Pakistan, especially before 70-80 years. And when the hormone D, now the hormone D at less than 55 to 75, the body definitely need the calcium for the bones and teeth in every cell of the body. Now the parathyroid hormone is increased, secondary hyperparathyroidism. This parathyroid hormone is called enemy of the bone, or rat which is eating the roots of the tree. These two names is given by some non-Muslim researcher, but from my side, this parathyroid hormone increase secondary to hormone D deficiency. This is just like a rat which is eating the currency notes of Pakistani people in the form of medicine. Now this parathyroid hormone will be removed in removing calcium from the bones to fulfill the needs of all other cells of the body except cells of the bones and teeth. So all the bones become weak, so there is rickets in Pakistan, and the vertebrae become weak, so there is back pain, joints pain, in early osteoporosis, early osteoarthritis, osteopenia, and short stature. If someone not remain deficient, the height will be not go up after 16 years. And teeth problems in the ossicles in the hair become soft, there is early deafness, and there is generalized body ache, fatigue, and tiredness. And the secondary hyperparathyroidism, the no reabsorption of the calcium from the renal tubule, so they lead to renal stones. So the white circle around the sun is called corona. So all the human beings who are female who are deficient of hormone D deficiency, 60 to 80% going for hospital delivery. If someone with normal 400, no chance delivery will be safely at home. And someone is born in Pakistan everywhere in the mother, milk deficient with folic acid and hormone D. So 2 lakh international units should be given on the first day. Then every day should be given 8 to 1000 units of hormone D daily up to 5 months. After 5 months, the International Light Association recommend 5-inch skin exposure of the legs every day up to 15 months. Then 10 minutes every day up to 3 years. And after 3 years to 8 years, the non-Muslim researchers recommend the whole body exposure should not be recommended for any human beings, but at least 30 minutes daily sunlight should be used on this. This is hadith. So this sunlight come and they making this pathway, and at the age of 16 years throughout the world, the bone density start to decrease. 1% bone density is lost in the male group and 6 times in the female. At the age of 30 years, the bone density loss 6 to 12 times in the male group and 12 to 26 times in the female. Bone density, just like the plants which grow under the other plants, bone density when decrease before age, one can never reverse. In the age of 45 in the female, when become postmenopausal in the male, at age of 55 the androgen decrease, so there is osteoporosis. Osteoporosis barbarafan, and when the hormone D is increased due to more use of sunlight not increase, one should be used steroid, delta-cartel, depomedrol. Unfortunately, in Pakistan, steroids are using for different pain in the joints and muscle pain and asthma and allergy, or anyhow allergies, asthma. These are actually due to hormone D deficiency, because the immune system is depressed. So the steroid is called enemy of the bones. So let's come, the world is suffering of nutritional disorder because hormone D is one of the most important source of diet. So if we concentrate on the Mansalwa that was full of all the balanced diet, which was refused by the start accumulating by the Bani Israel, so they got banned. And meat, fats all halal according to Torah in Surat Al-Anam, ayat number 145. وَلَلَّذِينَ هَادُوا هَرَمَنَا كُلُّ ذِي ظُفُرٍ وَمِنَ الْبَقَرِ وَلَحْمِ الشَّحُومَ إِلَّا مَا حَمَلَتْ ظُهُورًا should not be banned. That is against Quran. And Ashab Kahf were sleeping in the cave for more than 309 years. 309 years and 300 years. In a cave with 2 mouths, one toward the north, another to the south. As the Tafasir of Quran mentioned, that was lucky the mouth of the tunnel north to the sunset sign, which is called west sign, towards the west. Otherwise, there were chances to burn the skin. And there is hadith that the male should be exposed to this skin with walking. Otherwise, the skin not be go to Jannat. And that is heliotherapy, who was very famous. Helio is called sun, and therapy was the treatment by Greece people. And that was the Finson who was treated tuberculosis with heliotherapy, and that was who was awarded the Nobel Prize. That was the Finson who was treated lupus vulgaris, the tuberculosis of the skin, just with the sunlight. Unfortunately, in Pakistan, we are not exposing the skin to sunlight. Now, this is the old culture. So the round circle around the sun is called corona. And unfortunately, in cardiac patient, no one is asked, are you what is your job? Are you working in the sunny field or inside? So that is the wide circle around the sun is called corona. So anyhow, there are so many diseases in Pakistan, but I don't accept the diseases which is occurring due to not using direct sunlight in the summer on the skin. Unfortunately, I am the single doctor in the world which has recommend the sun for prevention of premature coronary disease. Why the Pakistani are suffering, especially the Muslim, of diseases which is not present in Quran? And these are actually the patients in the world which is telling about the diseases throughout the world. So the duty of the doctor to think for that basic causes of the diseases, not to give medicine for the disease. Because according to Ibn Sina, when you don't know the cause for the disease, if you advising medicine, that patient will be aggravating. So my comments, don't think for the cure of any disease anywhere in the world which you not correct the basic root cause of the diseases, otherwise that disease will be lead to your death. Okay, let's see what happened in the world. My challenge throughout the world, one day this sunlight will be used, because from my side there are one should be use good diet, because don't try to make your medicine your diet. Otherwise, if you not using proper diet, one day your medicine will become your diet. And the best doctor in the world are the sun, and the second is balanced diet, and the third is exercise for healthy life. Thanks God, sunlight is free, but unfortunately we don't know the benefits of sunlight. That was the time, because after Ibn Sina, some Pathan make the diagnosis, because the records in tuberculosis and poliomyelitis, these were the three health problems so common in Scotland. That disease were labeled by some doctor in the England, that is called darkness diseases. That was the tuberculosis, poliomyelitis, and rickets. In Pakistan, unfortunately, the rickets disease is with different brain weakness, disabled baby, mazur bacha, CP child. And so this disease by Pushtun called this is kamzuri due to saya. That was called darkness disease. Darkness means shadow, Urdu saya, Pushto ke sore. ती रिकट्स बच्चों को पाकिस्तान में पुख्तून बहुत हुई चिदा कमज़ोर है माशूम दे और बदे सोर है शे पठान का ये मतलब था कि इस बच्चे की बीमारी कमज़ोरी है, वजह यह है कि आप भी इसको सनलाइट से बचाए हैं. तो दिस इज़ द रीज़न we are suffering of diseases, because when the Gleason diagnosed this tilting of the legs and bending of the backs in 1652 in London, that was not cure. Anyhow, they label their disease, this is English disease, which is most common in Somerset and Somerset. Unfortunately, we don't love sunlight. That is the reason we're suffering of health problems, which is not present in Quran and Hadith. Okay, thank you. One should be think for the basic root causes of the disease, and that is the sunlight. Let's see what happens if someone not using sunlight on the skin, how we can prevent, how we can treat, how we can terminate diseases from Pakistan, which is just due to not using sunlight on the skin. Anyhow, I am lucky. My doctor, my name is, I am the middle one, and I am lucky. My country, Pakistan, is a sunny country. Inshallah, one day this sunlight will become main source of income of Pakistan, Pakistani people and government of Pakistan. When there is currency to pay in Pakistan, don't think for the Pakistan to become a rich country, because our people using a lot of money on medicine which have no benefit. Anyhow, let's see, because the most common cause in the world for suicide is hormone deficiency. Let's see why my colleague in Pakistan not recommend my recommendation. I don't know. Okay, thank you. Assalamu alaikum.